the HIV care continuum, this is the steps that a person with HIV takes from that initial diagnosis through their successful treatment with HIV medication. But really, I also think about the hexagon before the continuum, right, which is HIV testing and identifying those folks who have HIV so that we can prevent them from getting it in the first place. But primary care has a very important part at every one of these steps. So really, we're the key to HIV prevention. So we have lots of things that happen in a person's life before they discover that they may be living with HIV, right? Like they can experience significant amounts of stigma, violence, shame, homelessness, racism, poverty, all of those things that make it difficult for a person to receive and stay engaged in care affect our ability to diagnose them with HIV. And this is where primary care can have a really large impact in the community. So as we know, in caring for folks with HIV, there's no such thing as a single issue struggle because we don't lead single issue lives. We always think of the social determinants of health, right? Like what other things are happening in a person's life that makes it difficult for them to receive care. And that's not unique to HIV, right? If you look at the diabetes model for care management, these are all things that we need to address to decide if a person is getting the most equitable care. So we look at education, access and quality, healthcare and quality, neighborhood and built environment, the social and community context, and then a person or community's economic stability. And this is something where, especially in rural areas, we struggle with all of these things, right? But especially with distance to care can be a problem. And so anywhere that primary care can kind of step up and we say take the reins in South Dakota, but anywhere where primary care can kind of step up and help with all of those components really makes a big difference in the care that people receive. So the social determinant of health that we often overlook is social and community context, right? So that includes things like stigma, discrimination, racism, safety, community connections, and then a person's relationships with their family, friends, community, maybe with their healthcare provider. When we think of stigma, we think of a set of negative beliefs connected to a particular person, circumstance, or quality due to them having perceived control over that. But really, I just simplify it as any time, and we all do this, sometimes consciously and sometimes subconsciously, whenever we catch ourselves thinking, why don't they just, right? That's stigma in action. So when we catch ourselves, you know, why didn't that person just make it to their appointment today? Or why didn't this person go and get an HIV test? Or why aren't they taking their medications? Really, it's up to us to look into what all of those other things that might be going on that might be impacting that for them to kind of remove that judgmental piece.